Hello, my name is Josephine Buchansu. I am a student of Brandman University, and this I'll be doing a video on a psychotherapy session with my patients um, as part of the course Psychotherapy Across the Lifespan for Neuro 642, taught by Dr. Ruth Milstein. So the patient I'll be working with today is 18 years old. She is a college freshman, and she recently got diagnosed with anxiety. She actually started experiencing her symptoms like about a year ago, but she didn't officially have a diagnosis. She didn't know what that was. Um, so apparently, 1 year 1 year prior, my patient never had any kind of mental health problems, never been hospitalized before, and she has never done any kind of drugs, no illicit drug use, no, doesn't smoke cigarette, doesn't drink coffee, doesn't drink alcohol. But she had an encounter with friends on a night where they went out, and she ingested cannabis butter, that's a form of marijuana, in food that was offered to her by her friends without knowing. And ever since that experience, she has not really felt the same. So she got diagnosis of anxiety, and I will proceed to explain the choice of therapies that I've picked to use for her, and then we'll proceed from there. So the first type of psychotherapy I chose is psychodynamic psychotherapy. Um, it is derived from psychoanalytic psychotherapy, which was developed by Sigmund Freud at the end of the 19th century. This type of therapy is also referred to as insight-oriented, intensive, exploratory, and expressive and in-depth psychotherapy. Underpinnings of psychodynamics are rooted in developmental theory, with the basic premise that what has happened in the past determines what we are doing today. It is thought that through understanding these factors, the person is empowered and then free to make more conscious decisions and consequently live a more satisfying and useful life. Wheeler, 2014. Why did I choose psychodynamic therapy for my patient with anxiety? It is said that anxiety is central to understanding these difficulties, and even if a person does not feel particularly anxious, defenses and characterologically personality trait embedded in implicit memory system bind the person to a life that is restrictive, and compromises are made to keep anxiety at bay. Also, the job of psychodynamic therapists is to help the person understand how fears and inhibition in early life have led him or her to react to healthy feelings as if they were a threat, and how this display can and how this plays an active role in generating his or her difficulties in the present. Wheeler, 2014. The next type of therapy that I have chosen is motivational interviewing. So motivational interviewing is a collaborative, person-centered a communication process designed to help individuals resolve ambivalence and plan to change. It can be used alone to increase motivation for engaging in psychotherapy, or in combination with other forms of therapy when resistance is encountered. Motivational interviewing puts more emphasis on getting ready to change behavior. The spirit of motivational interviewing embodies a partnership with clients, incorporating the principles of acceptance, belief in the individual's autonomy, and acknowledgement of the individual's strengths and efforts, with empathy, honoring the worth of individuals, affirming their strength and respecting their autonomy, as adapted by from Carl Rogers' Person-Centered Therapy from 1965. Why did I choose motivational interviewing? It is said that since 2000, motivational interviewing has been used to motivate individuals diagnosed with anxiety disorders to engage in psychotherapy. Westra and Dozois in 2006 examined motivational interviewing prior to CBT, and found that those receiving motivational interviewing attended more CBT sessions and reported lower anxiety at 6 months past treatment than individuals receiving only CBT. Similar results were found in subsequent study of individuals with generalized anxiety disorder, as explained in Wheeler 2014. Thirdly, I will be using cognitive behavioral therapy. Aaron Beck developed a form of psychotherapy in the early 1960s that he originally termed cognitive therapy, but nowadays it's called cognitive behavioral therapy. Beck devised a structured, short-term, present-oriented psychotherapy for depression, directed towards solving current problems and modifying dysfunctional, inaccurate, and/or unhelpful thinking and behavior. Beck, 1964. Since that time, he and others have successfully adopted this therapy to a surprisingly diverse set of population with a wide range of disorders and problems. In all forms of cognitive therapy that are derived from Beck's model, treatment is based on a cognitive formulation, the belief and behavioral strategies, and characterize a specific disorder. The cognitive model proposes that dysfunctional thinking, which influences the patient's mood and behavior, is common to all psychological disturbances. When people learn to evaluate their thinking in a more realistic and adaptive way, they experience improvement in their emotional state and in their behavior. Beck, 2011. So why did I choose CBT? Treatment is also based on conceptualization or understanding of individual patients, their specific beliefs and patterns of behavior. The therapists seek in a variety of ways to produce cognitive change, modification in the patient's thinking and belief system to bring about enduring emotional and behavioral change. Back 2011. Now in my next session, I'll be talking to the patient using these three types of therapies that I just explained. Thank you very much. Hi.
Hi.
Welcome to the session today. I'm so happy you're able to make it.
Happy to be here.
So before we start, I will like to ask your consent to do this, to record our session today. So do you give me authorization to do a recording of our session today? Is that okay with you?
Yes, it is.
Thank you very much. So like we discussed in our last session, today I'm going to be using the psychodynamic psychotherapy. It's a form of therapy, and I know we already talked about how it works, but we're just gonna swing right into it. And tell me, how was your week? How's your week?
It was relatively good. Last night I experienced a pre-panic attack, is what I like to call it. And after that, today my thoughts have kind of just been lingering around that event. But other than that, I'd say my week has been pretty good and my day has been pretty good as well.
So what I understand by a pre-panic attack is like it was not too overwhelming. You were able to control it.
Yes, I was able to calm myself down. It never got like too out of hand where I was like gasping for air, but it was still like similar to one.
Okay. Tell me, whenever you have these attacks, how does that make you feel?
It makes me feel overwhelmed, and just like not the best, honestly.
Okay. I am going to do a little exercise with you. I have a couple of words here, and when I say a word, you give me like an automatic thought about it. You don't have to give too much thought to it. Just say whatever you think immediately, okay?
Okay.
Yourself. That's the first word.
Scared.
The next word is fears.
Mental illnesses.
Okay. Mood.
Overwhelmed and hopeless.
Okay. When you say these thoughts, can you think about all of them and like try to connect them together and see if there's a theme that embraces everything you just said?
I think part of me is scared of this anxiety like defining me and like just it becoming who I am. And I think that I like compare who I was to who I feel like this is turning me into, and I'm just scared that it's gonna be like with me for the rest of my life.
Okay. So if I heard you well, you kind of sound like you have a fear of having like a mental illness diagnosis, or to a fear of dealing with the mental illness. Is that
Yes,
what you're
yes, I
saying?
would say that. I would say that exactly.
Oh, okay. So has do you think that this has been the cause of your anxiety throughout? Do you think that this is where this anxiety is coming from?
I would think so because I typically think about my current like circumstances, and that just makes me feel more overwhelmed and hopeless and scared. And so yeah, I think that is a good pinpoint.
Did you ever thought about it this way before, or you?
No, I never did.
Okay, that's interesting. So, um, I feel like we have made some progress today. So now that it has been brought to your consciousness, your awareness that your anxiety is being caused by the fact that you're worried about having a mental illness, or dealing with it for the rest of your life. Now you know you know exactly what how you can deal with it. So um I'm gonna have you, when you go home, I want you to think about different ways that you think you can use to cope with your anxiety that can be healthy, and that can possibly, you know, um, can possibly like be like a an effective or healthy coping method. And we'll discuss that next in our next therapy. Okay.
Okay.
Thank you very much. Hi, welcome again.
Hi.
So, in our last session, we talked about, you know, your your fears, and you verbalized that you realized that your fear was rooted in the fear of mental illness, and you think that that could be the root cause of your anxiety. So today, I want us to use another form of therapy called motivational interviewing, and I'm going to use that to work on this your fear, and see how we can move forward from there. Okay.
Okay.
So tell me, um why were you able to find out, like, the reason behind your fear for mental illness? Were you able to find out anything?
Yes, I think it was just the idea of living my life without full control of my mind. Um, and like, yeah, my mind and like my emotions and stuff like that. Just being out of touch with myself.
I know that can be really overwhelming and mind-boggling to, you know, to feel like you're losing yourself. Um, so I'm gonna ask you, what even brought you to that point? Do you have like some friends or family members who are dealing with mental illness, that you see their struggle, or what brought you to that point?
Actually, my best friend has been struggling with mental illnesses from a very young age, and I've just seen how much pain it's caused her throughout her life, and how like it's just taken a toll on her. And I think also like even when I was young, I was like just always watching like documentaries and things where people were struggling with mental illnesses and other ailments that were just causing so much like struggle in their life, and it just made me kind of scared about ever experiencing that.
So what I'm understanding is that you've experienced, people struggling with mental illness. You see it's devastating. You've watched other people's experiences on TV, and now you are afraid that you might go down that same path, right?
Yes.
Okay. So I would like us to brainstorm on that. Maybe in our next session, I want you to come up with like positive ways that you think that you can deal with mental health in a healthy way. Like, I want you to write down like 5 different healthy ways that you can deal with your anxiety, so that it will be a positive experience for you, and not the same negative experiences you have seen the people around you. Okay, is that something you can do?
Yes.
All right, thank you very much. Hi. Welcome back to our session today.
Hi, glad to be back.
Yes. So last time we were talking about, um positive behaviors to deal with anxiety and so on. Today we're gonna do a different therapy which is called cognitive behavioral therapy, and it's gonna help us find this positive the thoughts that can help with anxiety. Okay.
Okay.
So I'm gonna do an exercise with you, and I will ask you a few questions because cognitive behavioral therapy typically focuses on how we think, which affects how we feel, and then it also affects our behavior. So these questions are going to be centered around that. Okay.
Okay.
So can you look back in your last few days and think about a negative something that triggered you to think negatively?
About 2 nights ago, I was feeling kind of guilty and ashamed at myself for not reading my Bible and praying before going to sleep, and I had been not doing that for some time.
Okay. So how did that make you feel?
It made me feel very disappointed in myself, and very just guilty. And
So what kind of behavior did you have in response to that?
well, after I fell asleep that night, I woke up, I jumped out of sleep and experienced a mini panic attack. And I was experiencing shortness of breath and kind of dizziness a little bit, and just racing thoughts and stuff like that.
Wow. So so you're now making a connection that these kind of feelings right before you go to bed can affect you even after you sleep to evoke such reactions,
Yes.
right?
Yeah.
So can you think of in the same situation, or how you would react rather positively to that same thought?
Maybe I could say it's okay that I haven't been reading in my Bible and praying, but as long as I just try to be more intentional about doing it moving forward.
Because you were feeling tired at that time?
Yes, because I was really tired. I felt like I was really tired that night.
Okay. So you feel like if you made up for it, like another time, maybe you decide to instead pray in the morning instead,
Yes.
that would have made you be more comfortable going to sleep.
Yes.
Okay. Oh, that's very good. So in our next session, I would like you to think of, you know, other positive, thoughts, other positive behaviors that you would use in reaction to a similar situation, or two other experiences that you have in your week, and we will talk about this in our next session. Okay.
Okay.
Thank you very much. Hello. So I completed 3 different sessions with my patient, and now I just want to give a brief summary of the 3 different therapy methods that I used. I feel very confident of the choices of my 3 therapies. Firstly, psychodynamic psychotherapy is most suitable to use in the initial phase of therapy, where it will help my client uncover on any unconscious or repressed feelings and experiences in their past that may be reshaping their present life and experiences without them being fully aware of. Psychodynamic psychotherapy will help the client to relate their past experiences and make the connections to how this may be affecting their current feelings, and bring out into awareness. This will enable the patient to move into a higher level of functioning, where they are more able to deal with their own problems. Secondly, motivational coaching, motivational interviewing, use the OARS, which stands for Open Questions, Affirmation, Reflection, and Summarizing Communication Guide, which helps engage the client in a trusting and respectful relationship, without which there is little hope of facilitating a change in behavior. Most importantly, one of the evidence-based successes in motivational interviewing is the fact that it helps the client to adhere to therapy such as cognitive behavioral therapy. Finally, cognitive behavioral therapy, which is the last form of therapy that I use, is an acclaimed success rate, has an acclaimed success rate in the treatment of individuals with mild cases of anxiety, like my client. Cognitive behavioral therapy has been extensively tested since the first outcome study was published in 1977 by Roche, Beck, and Kovacs and Holman in 1977. At this point, more than 500 outcome studies have demonstrated the efficacy of cognitive behavioral therapy for a wide range of psychiatric disorders, psychological problems, and medical problems with psychological components. Beck 2011. Therefore, the combination of these three different approaches of psychotherapy will be very effective in covering all possible areas of difficulties in my client's life that may be posing as different stressors for her. Finally, I want to comment on the cultural adequacy of these three therapies for my patient. So my patient happened to be of African American origin, and she fitted right in to all the three different therapies. And according to literature, these therapies are suitable with people of all cultures, all ages, and all backgrounds. Thank you very much for your kind attention.